psilocybin and hallucinogenic mushrooms, chemistry, mechanisms, and therapeutic potential. Psilocybin is a naturally occurring psychedelic compound found in certain species of mushrooms, primarily within the genus Psilocybe. Increasing clinical evidence highlights its potential as a therapeutic agent for psychiatric and neurodegenerative disorders. In this video, we will discuss psilocybin's chemical properties, pharmacology, mechanisms of action, and clinical applications, alongside its historical use and safety considerations. Psychedelic compounds have been used for centuries in traditional medicinal and spiritual practices. Among these, psilocybin-containing mushrooms, commonly referred to as psychedelic or magic mushrooms, have played a prominent role in indigenous cultures of Central and South America. These mushrooms contain psychoactive tryptamine derivatives that induce altered states of consciousness, including perceptual distortions, emotional shifts, and cognitive changes. Scientific interest in psychedelics intensified during the mid-20th century, particularly following the synthesis of lysergic acid diethylamide, LSD, in 1943. However, socio-political factors and non-medical use led to strict regulatory control by the 1970s, halting most research. In recent decades, a resurgence of scientific inquiry, often termed the psychedelic renaissance, has renewed focus on compounds such as psilocybin due to promising clinical outcomes. Psilocybin and psychedelic mushrooms. Psilocybin is found in over 100 species of mushrooms, predominantly in the Psilocybe genus, including Psilocybe cubensis and Psilocybe semilanceata. These mushrooms biosynthesize psilocybin as a secondary metabolite derived from the amino acid L-tryptophan. Chemically, psilocybin is a phosphorylated tryptamine alkaloid. Upon ingestion, it is rapidly dephosphorylated in vivo to psilocin, the pharmacologically active compound. Psilocin structurally resembles serotonin, 5-hydroxytryptamine, 5-HT, enabling it to interact with serotonergic receptors in the brain. Psychedelic mushrooms vary in potency depending on species, cultivation conditions, and psilocybin content. The use in traditional settings has typically involved controlled ceremonial ingestion, often guided by experienced practitioners to facilitate psychological and spiritual experiences. Chemical structure and biosynthesis. Psilocybin is biosynthesized from L-tryptophan through a multi-step enzymatic pathway involving decarboxylation, methylation, hydroxylation, and phosphorylation. The compound acts as a prodrug, with psilocin responsible for central nervous system activity. After oral administration, psilocybin is rapidly absorbed and converted into psilocin, which crosses the blood-brain barrier. Peak plasma concentrations typically occur within 1 to 2 hours, with effects lasting approximately 4 to 6 hours depending on dose and individual metabolism. Pharmacology and mechanism of action. Serotonergic activity. Psilocin primarily acts as a partial agonist at serotonin receptors, particularly the 5-HT2A receptor, which is widely expressed in the prefrontal cortex. Activation of these receptors is strongly associated with the characteristic psychedelic effects. Psilocin also exhibits affinity for other serotonergic receptor subtypes, including 5-HT1A and 5-HT2C, contributing to its complex pharmacological profile. Neural network modulation. Psilocybin induces significant changes in brain connectivity. Increased global connectivity across normally segregated brain networks, reduced activity in the default mode network, DMN, associated with self-referential thinking, enhanced communication between cortical and subcortical regions, including the thalamus. These effects are believed to underlie altered perception, ego dissolution, and enhanced emotional processing. Effects on neuroplasticity. Emerging evidence suggests that psilocybin promotes neurogenesis, formation of new neurons, synaptogenesis, formation of synaptic connections, dendritic spine growth. These processes contribute to improved cognitive flexibility and may explain sustained therapeutic effects after a single or a limited number of doses. Therapeutic applications. Unlike conventional central nervous system (CNS) medications, psilocybin is typically administered in a structured therapeutic setting that includes psychological preparation, supervised dosing, and post-session integration. Depression and anxiety. Clinical trials have demonstrated that psilocybin can significantly reduce symptoms of major depressive disorder and treatment-resistant depression. Improvements are often rapid and sustained over weeks to months following limited dosing sessions. In patients with life-threatening illnesses such as cancer, psilocybin has been shown to reduce anxiety and depression while improving quality of life. Standardized measures such as the Hamilton Depression Rating Scale and Beck Depression Inventory have confirmed these effects. Addiction and substance use disorders. Psilocybin has shown promise in treating addiction, tobacco dependence, high abstinence rates observed in long-term follow-up studies, alcohol use disorder, reduced consumption and craving following guided sessions. The therapeutic mechanism is thought to involve psychological insight, emotional processing, and disruption of maladaptive behavioral patterns. Obsessive-compulsive disorder, OCD. Preliminary studies indicate that psilocybin may reduce OCD symptoms, with some patients experiencing significant improvement after a single administration. Cluster headaches. Case reports suggest that psilocybin-containing mushrooms may alleviate cluster headaches, a condition often resistant to conventional therapies. The mechanism may involve serotonergic modulation of vascular and neural pathways. Neurodegenerative disorders. Although still under investigation, psilocybin's ability to enhance neuroplasticity and reduce inflammation suggests potential applications in early-stage neurodegenerative conditions such as Alzheimer's disease. Safety, risks, and contraindications. Safety profile. Psilocybin is considered to have low physiological toxicity, minimal risk of dependence or addiction, no known lethal dose in humans under typical conditions. However, its classification as a controlled substance in many countries reflects concerns about misuse rather than intrinsic toxicity. Psychological risks. Adverse effects are primarily psychological and may include anxiety or panic, bad trips, paranoia or transient psychosis, perceptual disturbances and derealization. These effects are more likely in uncontrolled environments or in individuals with underlying psychiatric conditions. Contraindications. Psilocybin is contraindicated in individuals with psychotic disorders, e.g., schizophrenia, bipolar disorder, risk of manic episodes, severe cardiovascular conditions due to transient increases in heart rate and blood pressure. Careful screening and controlled clinical settings are essential to minimize risks. Treatment model and clinical framework. Modern clinical use of psilocybin follows a structured protocol: screening and preparation, guided administration in a controlled environment, psychological integration sessions. This model emphasizes set and setting, referring to the patient's mindset and physical environment, both of which significantly influence therapeutic outcomes. Current challenges and future directions. Despite promising results, several challenges remain. Regulatory restrictions limiting large-scale clinical trials, lack of standardized dosing protocols, variability in subjective experiences, need for long-term safety data. Future research may focus on development of non-psychoactive analogs, personalized psychedelic therapies, combination treatments with psychotherapy or pharmacological agents, exploration of microdosing strategies. In conclusion, psilocybin represents a novel and promising approach in the treatment of psychiatric and neurological disorders. Its unique mechanism, modulating serotonergic signaling and enhancing neuroplasticity, distinguishes it from conventional pharmacotherapies. Clinical evidence supports its efficacy in depression, anxiety, addiction, and other conditions, particularly when administered in structured therapeutic settings. While safety concerns and regulatory barriers persist, ongoing research continues to expand understanding of psilocybin's therapeutic potential. With further validation through rigorous clinical trials, psilocybin-based treatments may become an important component of future neuropsychiatric medicine.